Now that you understand how to design your medicine ball training program, let's begin with torso training. Our first exercise will be demonstrating how to use a medicine ball with the back extension exercise from a back extension bench or a glute ham developer. This is the glute ham developer machine, which is developed by IM&M Exercise Equipment from Canyon City, Colorado. I have found this to be a far more beneficial piece of equipment than your standard back extension bench due to the fact that it increases the activation of the gluteus and hamstring musculature in the back extension movement exercise. If you're interested in this piece of equipment, you can call 1-800-430-4848 and have literature sent to you describing its many special functions. Now, first we're going to go ahead and place our athlete up on the pads. Now, unlike your typical back extension bench with the glute ham developer, the thighs are placed on the pads. As you see, when Rhonda comes up into extension, doing the extension exercise, the muscle force length relationship of the muscle is not optimal due to the fact that when she's all the way up at the top of the motion, where gravity is the greatest, the muscle is approaching its shortest position. The human muscle is not strong when it's short. It's strong in its mid-range. So using a medicine ball, we can bring the body towards a more balanced force-length relationship. What we do is hand the patient or athlete the medicine ball. As they come up into extension, when gravity is increasing, the ball is going back towards the pelvis, reducing the lever arm against the back extensor muscles. As she drops down, she takes the ball away from the pelvis, increasing the length of the lever arm, increasing the load against the back muscles, which brings the force-length relationships more towards ideal. Now, the last exercise we demonstrated was more for strengthening. Now, if you want to get some more power development or some more dynamic action using the medicine ball, you can have the patient or athlete toss you the ball from this back extension position. This is a very useful exercise for athletes such as divers and gymnasts who have to have dynamic movement through the air or in an open chain type situation as well as the closed chain situation. Here's how the exercise is performed. The therapist should first have the athlete perform the exercise in a concentric only fashion. As the exercise is progressed, the patient will be allowed to receive the ball from the therapist. What you can see here is that my model is being conditioned not only in the sagittal plane as was done with the strengthening exercise, but now she is moving into the sagittal plane, the transverse plane, and the frontal plane due to the fact that she has to rotate and side bend to get the ball to me in these various positions, which makes it a much more complete exercise. It's very important to find the pattern of movement that your patient was injured in and condition them in that pattern to prevent reoccurrence of the injury. At this point, I will demonstrate the progression from concentric only to concentric eccentric action. For therapists who may be treating patients which have antrolisthesis, spondylolisthesis, or a lumbar disc injury, positioning is a very important precautionary factor when performing this type of exercise. Many people do not pay attention to the position of the pelvis when placing people on back extension benches. What I want to show you here is that if the pelvis, especially anterior superior iliac spines, are placed on the pad, what will happen as the patient or athlete drops into flexion is it will accentuate lumbar flexion, which may aggravate a disc injury and even a retrolisthesis. So what we must do in those precautions where we want to strengthen the back extensor muscles without a lot of motion in the lumbar spine as an entity is go ahead and position your patient forward so that the hip joint becomes the axis of rotation. What you will see now is that Rhonda will be able to maintain a neutral spine as she drops down because she's extending from the hip joint. Positioning the patient this way will protect you from overflexing the lumbar spine, potentially aggravating any injury that does not respond well to flexion. Medicine balls can be used effectively for developing increased strength and/or increased power in both patients and athletes using a back extension bench backwards. What we do is place the ball between the feet, and to isolate the gluteus maximus muscle more effectively, we bend the patient or athlete's knees and have them extend the legs up. Now, you do not want to hyperextend the spine, but work within the range of neutral and then have them drop back down, keeping the knees bent. Now, as I mentioned to you earlier in the basic sciences section, the speed of movement has a big effect on the length of time that the muscle is under tension. So if you're developing strength in the muscle, you're going to want to use heavier weights at slower speeds. For developing power, we will use faster speeds. To bring the resistance out of the glutes and more into the entire hamstring group, we'll let the legs straighten out, and now he will extend. Here you're sharing the load more effectively across the hamstrings, glutes, and back musculature. The hip extension exercise can be used to develop power in the hamstrings, glutes, and low back by simply having the patient or athlete toss the ball to the coach or therapist. There you go. And up. Excellent. One more. Explode. Very good. Positioning precautions with the hip extension exercise parallel those of the back extension exercise. Always consider the amount of flexion in the lumbar spine, and once again, you can change the amount of flexion in the lumbar spine by properly positioning the patient. The medicine ball can be effectively used with the good morning exercise to develop strength in the hip extensor mechanism. We begin the patient or athlete by holding the ball to their stomach. Start by putting the knees in a 20-degree angle, which increases the activation of the gluteus maximus muscle due to the fact that at this knee angle, the iliotibial band is at maximal tension, allowing the greater portion of the gluteus maximus a good anchor point to extend the trunk from and also to lower the trunk eccentrically. From here, the athlete or patient bends forward, moving from the hip joint, keeping some extension in the lumbar spine or keeping an arch in the spine, preventing excessive flexion as required by the patient's diagnosis. And then she comes back up, and to increase the load, we bring the ball up to the chest, once again keeping the 20-degree bend in the knee at all times and bending forward. We want the client or patient to move from the hip joint, once again protecting the lumbar spine from excessive flexion, and then back up. And then the ball can go behind the head for another increase in the level of resistance. And finally, the ball can be placed above the head. Care must be taken not to let a lot of load go through the neck. If the athlete or patient can hold the ball effectively above the head, this level of resistance can be used. If there is a precaution with the neck, you can simply give the athlete or patient a heavier medicine ball. The good morning exercise can be used to develop power in the lumbar extensors and the hip extensors effectively by having the athlete go down into the good morning position and exploding out, tossing the ball to the therapist. We start with concentric only exercise in cases of training patients and/or introducing an athlete to this exercise for the first time, because the eccentric exercises are much harder on the muscle. The progression would be to have the athlete or patient perform the exercise through its concentric and eccentric forms. And do it. Precautions with the good morning exercise are primarily in positioning of the patient or athlete. The knees must be kept bent to a 20-degree angle, not only to ensure activation of the gluteus maximus, but to allow freedom of the pelvis to rotate in forward bending. If the knees are locked in hyperextension, it tightens the hamstrings. If the athlete or patient has short hamstrings, it will force the lumbar spine to round out as the athlete or patient goes into flexion, which may aggravate a pre-existing disc condition or create a disc condition. Done properly, the exercise is performed with the knees bent to 20 degrees. Instruct them to hold an arch in the low back and push the behind out and back up. One more. And up. If you have a patient or an athlete that seems to have a hard time maintaining the proper position of the lumbar spine with this exercise, I recommend taking 2 strips of athletic tape, running them down the back with the patient standing in a neutral lumbar curvature, and having them perform the exercise. Each time they lose their form, the tape will pull on their back, increasing their proprioceptive awareness of where their lumbar spine should be during the exercise. The kneeling back extension can be used as an isolation exercise, whereas the good morning exercise is a more effective integration exercise. At this point, due to the fact that we're kneeling, the gastrocsoleus complex is shortened, and there's more force requirement from the gluteus maximus and the back extensors in this position. The patient can simply bend forward, maintaining the lumbar curvature, and come back up into extension. The medicine ball is very comfortable in this exercise. It fits comfortably behind the neck, and this movement pattern is very common for many workers, such as people that have to do cleaning on their knees, cleaning hotels, restaurants, etc. Now, many patients will not be able to perform this exercise comfortably due to restricted ankle plantar flexion. So we use a total gym elevation platform or a Reebok step with a pad to protect the knees and perform the exercise in the same fashion, although now there is greater range of motion afforded due to the freedom in the ankle joint. Go ahead. Precautions with this exercise are the same as the good morning exercise. You must be very careful not to increase lumbar flexion beyond the tolerance of the patient. This is especially important when rehabilitating someone from a herniated lumbar disc, due to the fact that flexion of the lumbar spine may cause tearing of the annular fibers or tearing of the scar over the annular fibers if it is prematurely administered. Using the same positioning precautions, the kneeling back toss is a better form of isolation for the hip extensor musculature and trunk extensor musculature due to the fact that you're eliminating the knee extensors. The exercise is performed as follows. This exercise is used in cases where an athlete or a patient may have weakness in the trunk extensor or hip extensor musculature and have ample strength in the quadriceps, or in cases where an athlete may have well-developed legs and relatively undeveloped trunk and hip extensor musculature. The back toss exercise is an excellent exercise for developing power in the lumbar, hip, and knee extensor musculature. The start position is with the knees bent and in a squat position with a neutral lumbar spine. The elbows should be inside the knees. This is much like the start position of a power clean exercise. From here, the athlete explosively tosses the ball backwards. It is very important that you maintain the position of the lumbar spine. Arch back, elbows just outside the knees, head up. Keep the back tight, When you come off the ground, think of pushing the earth away from your body. Don't think of jumping, thinking you're trying to drive the earth out of its orbit. If you can do that, let me know. I need to hold on to something. All right? Don't catch the ball when it comes to you. You're going to back toss to your partner's going to back toss back to you. When we do the exercise, get enough space that you don't hit your partner or you don't hit someone else. One of these balls in the head can cause hospitalization. The kneeling wood chopper is a more effective technique for isolating the abdominal musculature. When performing the exercise, the athlete must be encouraged to recruit the abdominal musculature from the oblique region as they accelerate the ball, due to the fact that if there is weakness in the abdominal musculature, the athlete or patient often attempts to make this an arm exercise. Go ahead. Great. Precautions with this exercise are in that there is flexion and rotation coupled, which, as many of you know, is harmful to the lumbar discs. The therapist or coach must be very careful to observe that there is not excessive flexion from the lumbar spine. The primary movement here is flexion from the hip joint and rotation from the torso. Flexion and rotation may be progressed as tolerated by the patient or as needed for any given work or sports situation. The wood chop exercise is an excellent exercise for strengthening the abdominal musculature, the hip and thigh musculature in both the sagittal, frontal, and transverse planes. The exercise is performed by taking a medicine ball that bounces, such as a gel ball demonstrated here, bringing it up over the head, off to the side. From here, with a stable stance, a little wider stance, the athlete then accelerates the ball down to the floor using the abdominal musculature in an explosive movement pattern. This exercise is very effective because it trains the abdominal and leg musculature in patterns of movement that are common to many work and sports situations. The wood chop exercise can be effectively used with EFI Total Gym's rebounder. When rehabilitating a patient or athlete, I advise beginning the exercise with concentric muscle action only. The patient is then progressed to concentric eccentric action by allowing the patient to catch the ball. The kneeling wood chop exercise is an excellent form of isolation for the oblique abdominal musculature as well as integration of the abdominal musculature with the upper extremity musculature. The reverse wood chop exercise is an effective form of strengthening for the back extensor musculature, the hip extensor musculature, the torso musculature, the knee extensor musculature, and the shoulder flexor musculature. This exercise exercises the athlete in multiple planes of motion. And stop. A precaution with this exercise is to make sure that the athlete or patient does not overflex or over-rotate the lumbar spine as determined by the diagnosis. This exercise is very effective for most all sports requiring extension rotation movement patterns and most any work situation requiring extension rotation movement patterns. This exercise is also very effective because there's a weight shift. When the athlete or patient goes down into the start position, the weight is over the outside leg, and as they transition into the end position, the weight shifts to the opposite leg, working the body in the frontal plane. As many of you know, most exercise programs are deficient in the transverse and frontal planes. That is why the wood chop and the reverse wood chop exercise are excellent additions to most any exercise program. The exercise may be done at very slow speeds for strengthening in these patterns of movement, and even slower. Or it can be done explosively for power development. Great. The kneeling reverse wood chop is an effective method for isolating the hip extensors, trunk extensors, and shoulder flexor musculature, whereas the standing wood chop is more of an integrative exercise. The kneeling wood chop is an isolating exercise. This exercise too may be used in a slow pattern of movement for strengthening, or explosively for power development. This form of integration versus isolation is very important, because if an athlete, for instance, has an injured back, they will compensate by using their calves, thighs, and arms and minimize the use of the back. So the standing reverse wood chop would not be the best form of rehabilitative exercise to choose, due to the fact that they will compensate and avoid the use of the injured area. By putting the athlete down on their knees, it forces them to use the muscles that have been weakened due to injury. This is a far better mechanism for rehabilitating the injured back in patterns of movement used in the work or sports environment, and excels beyond your standard back extension or trunk flexion type exercises done predominantly in the sagittal plane. The medicine ball makes an excellent form of resistance when doing abdominal training. I prefer to use a Swiss ball to perform abdominal exercise from, because it allows a greater range of motion, strengthening the abdominal musculature in positions where spinal injuries often happen, being behind the midfrontal plane or in extension and in rotation. What we're going to do now is demonstrate how to use the Swiss ball coupled with the medicine ball to perform effective abdominal conditioning exercises, both in the sagittal plane and for the oblique abdominal musculature using the transverse plane and frontal plane. So what we're going to do here is have Jackie hold the ball to her chest and perform an abdominal crunch. And as you'll see, she drops back into extension over the ball, which allows the musculature to be conditioned behind the midfrontal plane, which very few abdominal exercises allow when exercising from a floor or from a bench. Now, the exercise can be progressed by moving the ball up over the head, which you must take precaution if someone has a neck injury, that they do not compress the neck with the ball. Now, initially, if an athlete or patient has a spinal range of motion deficit, or you're trying to progress them slowly and carefully, it's best to perform the concentric form of the motion or concentric phase of the exercise only. So we'll have Jackie just come up and do the crunch, and then the therapist or a trainer would take the ball and allow them to reposition and crunch again, and then drop back. A progression from the concentric only, of course, would be the concentric eccentric. And then from there, we would go to the more dynamic concentric eccentric phase of the exercise, in which Jackie would throw me the ball. Now I can control the load that she is receiving eccentrically by how hard I throw her the ball and by the position for which she catches the ball. If the ball is caught at a low position, such as the chest, the eccentric load is significantly less than if the ball is caught above the head. Care must be taken not to use too large of a medicine ball without anchoring the feet, or your patient or athlete may end up with a head injury from flipping over the Swiss ball, which would not be good. Now, what I've been demonstrating here is predominantly a sagittal plane motion. We need to get the oblique musculature involved so we can perform all these exercises in the oblique pattern. So what I'd like to do now is just give you a demonstration of how I would perform oblique motions both in the supine position as a strengthening exercise and then progressing to the more dynamic oblique exercise. Now once again, the ball would be progressed up towards the top of the head to increase the resistance, moving in the oblique pattern. And then Jackie could start throwing me the ball, and this would allow me to condition her in rotational movements. Once again, your selection of your exercises is greatly influenced by the work or sports environment. And you can see here that the further I go to the side, the more of an oblique angle she has to operate at. And this is a great exercise for integrating the upper extremities with the torso, especially after spinal injuries, because upper extremity loading has a significant impact on the spinal structures due to the lever arm created when the ball or any weight is caught or handled at an arm's length. Now from here we progress to a seated position on the ball. Supine exercises are great for beginning level conditioning, but the work or sports environment seldom takes place in the supine position. So what we want to do now is demonstrate sagittal plane and oblique tosses so that you can see how we condition the upper abdominal musculature and the oblique abdominal musculature, not only in the seated position, but on an unstable environment, which is far more effective because you can always progress effectively from an unstable environment to a more stable environment. But if you try to condition an athlete on a stable environment, such as a bench or a floor, and return them to the playing field, which is relatively unstable and very dynamic, it's too much of a progression. It's far better to put them in a more unstable environment and progress them to a more stable environment, which is easier for the nervous system to adapt to. So here we're going to do a demonstration of seated oblique and sagittal plane tosses. Now once again, the weight of the ball greatly influences the outcome. The position of the ball. If I throw the ball higher, it's harder for her to catch, putting more load on the upper abdominal musculature. Then I can start going at oblique angles, which will work her in all different patterns of movement, and I can throw the ball into many different positions, forcing her to recruit different fibers of the internal and external oblique musculature, as well as forcing her to have to stabilize with different strategies from many different positions on the ball. Now the next thing we're going to do is demonstrate how to use a rebounder. Once the athlete understands how to do these patterns of movement, she or he can effectively reproduce these patterns of movement off of a rebounder. And then go ahead and do your sagittal plane tosses. Now, Jackie can control where the ball goes and how far it goes. She can make the ball go higher above her head, or she can make the ball go slower and lower towards her chest. Once the patient or athlete understands the concepts and how to perform the exercise, they can accomplish all your therapy objectives with good instruction. Now, to get the oblique musculature involved, you can do two things. You can throw the ball at an angle and work out of a sagittal plane, or you can turn the athlete or patient sideways on the ball and do oblique tosses, and of course you'll have to work each side independently. And then we'll try the other side. Now this works great when you have to manage several people at one time, and you know that the patient or athlete is of the level that they can understand the exercise. Excellent. Now the exercises can be then progressed to a standing position, which would be considered an integrative exercise. Your strengthening exercises where you're laying on your back on the ball would be considered an isolation exercise for the abdominals. Then we begin integrating the upper extremities by tossing the patient or athlete the ball. Then you're getting an interaction between, of course, your abdominal musculature, your upper extremities, and then your balance capacities. Of course, like I said earlier, few sports take place in a supine position, with the exception of wrestling, and then occasionally you're swimming, like the backstroke, you may be in a supine position. So those are specific applications for that type of abdominal conditioning. But in reality, most sports take place in the standing position. So what I'd like to do now is demonstrate the sagittal and oblique plane movements that I would perform with a patient or athlete as an integrative progression with abdominal conditioning. So we'll have Jackie stand. We'll get rid of the Swiss ball for now. So here we're working mostly sagittal plane, and then I can alter the position of the ball, which will force oblique recruitment. Now you can change the stance of the athlete, which will affect the way it feels in their body and the way they recruit. So Jackie, let's go left leg forward. Now, of course, if you're rehabilitating a soccer player, you might want to go both feet parallel and train them to throw the ball, emphasizing the abdominals, which could improve the distance that they can throw in from the free throw line. Then we can go more oblique. And as you can see, if you watch Jackie's lower extremities, you can see that there's a lot of integration taking place between the abdominals, the hips, the knees, ankles, feet, and then, of course, the upper extremities, and even in the head and the neck. From the kneeling position, the abdominals can be effectively conditioned. Now, the kneeling position is unique because it's different than being seated on the Swiss ball, and it eliminates the contribution of the ankles and knees, isolating the motion to the hips, abdominals, and upper extremity. I will now demonstrate some sagittal plane movements for the upper abdominals and then some oblique tosses. Now, until you've tried the kneeling position, you cannot appreciate how different it feels in the body. This is especially important for rehabilitating people like plumbers and electricians who may have to do a lot of work in a kneeling position in corridors or and pulling conduit under houses, etc., because they have to use their abdominals and upper extremities from a position where they must stabilize off their knees. The next exercise I would like to demonstrate is an explosive exercise for strengthening the oblique abdominal musculature. It's a very challenging exercise, and there are some key points that must be remembered for good form and proper technique and to get the proper result from the exercise. Now, we're going to have the athletes in a seated position. They're going to drop back to an approximate 45-degree angle, which creates a postural load or a stabilizing load on the abdominal musculature, increasing the complexity of the exercise. At this point, one athlete throws the ball to the other athlete. Now you'll see here that they're throwing the ball far enough out in front of each other that it puts a load on the abdominal musculature when caught. If the ball is thrown incorrectly, the ball must be caught, brought to the body, which stops the movement. It takes away from the load of the exercise. It stops the plyometric effect. Now, the exercise can also be modified if you want to encourage full range of motion training as opposed to plyometric training by asking the athlete to touch the ball on the ground at the end of each repetition. So as you see here, they're rotating till the ball touches the ground. Now for plyometric training, which is a more end-stage exercise, the exercise is performed at a faster speed and the ball is only brought as close as possible to the ground without touching. Because what happens is if they stop the ball, the muscles and the musculotendinous unit lose their stretch energy, and then it becomes primarily a strengthening exercise and you lose the nervous system effect. Now what you want to do is try to make sure that you stay seated back at least at a 45-degree angle. A symptom of fatigue in this exercise is that the athlete sits upright. Also, to vary the exercise, you can vary the trunk position. So I can indicate, go ahead, both of you drop back further. And try to go back a little further. And what you will see is that the further back they go, the harder the exercise becomes. And then you can go ahead and sit up a little bit. And this gives you an idea of how to manipulate the exercise to achieve the desired result for both strengthening and the plyometric effect. Important precautions to the seated oblique toss are that it is very hard on the spinal structures. This exercise should not be performed by anybody that does not have a fully functional spine and musculoskeletal system. I would never recommend this exercise to anybody recovering from an injury, especially due to the fact that it's performed in a seated or a semi-reclined position during which there is a lot of pressure in the disc, as much as 140% or greater. This exercise is intended for conditioned athletes, predominantly performing in sports that require explosive strengthening and conditioning. The upper body Russian twist is an excellent exercise for developing strength and power in the oblique abdominal musculature. Performed from the Swiss ball, we start using slow speeds of movement and controlled ranges of motion as a warm-up. As the musculature surrounding the spine, including the oblique abdominal musculature, are warmed up, the speed of movement is progressed. The exercise can be made as dynamic and ballistic as needed for any given work or sport situation. The lower body Russian twist is an excellent exercise when combined with the Swiss ball. This form of the Russian twist is very useful in clinical situations when people with lumbar spine dysfunction have limited rotation in the lumbar spine and torso. We begin the exercise by simply rolling the torso left and right as a warm-up. As the tissue warms up and the pain-free range of motion expands, the patient or athlete is encouraged to take the exercise to end ranges of motion. To provide an overload, we put a ball between the patient or athlete's legs, which significantly increases the load on the oblique abdominal musculature. As you can see, the arms are held outward and palms down to stabilize the torso. Once the athlete has progressed on the Swiss ball exercises to being able to perform that exercise with approximately a 16-pound ball, we then go to the full Russian twist. We straighten the legs up in the air and we place the medicine ball between the knees, which reduces the lever arm against the torso. The exercise is performed until you can reach your repetition window or the requirements specified by the coach or therapist. From there, the exercise is progressed by bringing the ball further toward the feet. Here's how the exercise looks. Once again, as the spine warms up, the speed of movement increases and the range of motion increases. End stage progression on the Russian twist is by placing the ball between the feet. Use the same warm-up procedures described previously. Good. The hook sit-up pass is an excellent exercise for conditioning athletes that have no spinal conditions or medical precautions. It heavily stresses the hip flexor, upper abdominal musculature, and latissimus dorsi musculature, and it is performed and progressed as follows. First, you hook your legs together, holding on to your partner so that they are able to anchor themselves and effectively recruit the hip flexors, abdominal musculature, and upper extremities without flipping over backwards under load. You drop back, and initially you pass the ball at chest level. You want to drop back till the shoulders touch the ground in cases where you want to get maximal recruitment of the abdominal musculature. Now, if you want to get a plyometric effect in the abdominals, it's more effective to go as close to the ground as you can, but not actually stopping on the ground, because as soon as you stop and hit the ground, you lose the stretch energy in the musculotendinous unit. So what we're going to do now is a quicker version that's more choppy and more ballistic, which would be more related to sports conditions. Now, to progress the exercise so that there's more load on the abdominal musculature and lat musculature, we will start throwing the ball higher above each other's heads, which will put a greater eccentric load on the abdominal musculature, the lats, and the hip flexors. The unhooked sit-up pass is an interesting exercise in that it's much harder to use the hip flexors effectively to explosively throw the ball. So it puts more emphasis on the upper abdominals and the latissimus dorsi musculature. What we do in this exercise is you drop back to the floor, you stay on the floor, and you explosively toss the ball. As you release the ball, you come up into a seated position, and then your partner will catch the ball and throw it back to you. Now, where the abdominals really come into play is as you activate your latissimus dorsi muscle explosively, you're going into a trunk curl pattern to explosively throw the ball. That causes heavy recruitment of the abdominal musculature. You should attempt to keep the lower abdominal musculature activated, because as you activate the latissimus dorsi muscles, which attach to the back of your pelvis, they will attempt to tip the pelvis forward. So keeping in mind that your latissimus dorsi are antagonists to the abdominal muscles, you want to try to keep a little tone in those lower abdominal muscles so that you don't end up hyperextending or arching the back as you initiate the throw, because that could potentially lead to muscle balance problems later. So to do it in slow motion, we want to start from here, tighten those lower abdominal muscles, explosively toss the ball and sit up. Now you want to try to keep the feet down on the ground. If your feet are coming up in the air, that means that you're trying to recruit from your hip flexors, which will be taking away from the use of the abdominal musculature. And then, of course, you can get explosive as your partner can tolerate. The medicine ball can be effectively used to condition the lower abdominal musculature. Prior to using medicine ball training to condition the lower abdominals, you should meet the coordination and strength requirements as presented in scientific abdominal training. If you try to use a medicine ball prematurely, you will only foster muscle imbalance and encourage overdevelopment of the hip flexors. Considering that you have normal lower abdominal strength and coordination, we begin lower abdominal conditioning with the medicine ball by placing the patient or athlete on the ground. The ball is placed between the feet and held between the feet with the adductor muscles. To activate the lower abdominals, the pelvis is rolled posteriorly, flattening the back against the ground. Now, many people will have a problem with proprioception if they're using a mat that is too soft. I recommend using the firmest surface possible. I found the Airex mats to be the most effective for this type of training. Another important factor is that many people do not have a sense or a good proprioceptive sense of where their spine is at. To aid in increasing the proprioceptive sense, I recommend placing the hands under the low back at the belly button level. The belly button represents the apex of the lumbar curvature, which is approximately L3. So at this point, Tony rolls his pelvis back, pressing his spine against his fingers. We want him to feel the spinous processes on the finger, not the erector spinae muscles. This is very important when working with athletes because many of them have well-developed erectors, and even though they feel the pressure of the erectors on the fingers, their spine may rise up due to overexcitation of the hip flexors or the hip flexors dominating the lower abdominals, which pulls the spine into lordosis and the pelvis into anterior pelvic tilt. So knowing now that he can feel his spinous processes on his fingers, he's rolled the pelvis back, he's stabilizing the lumbar spine and pelvis effectively with the lower abdominal musculature. We start with the knees fully bent, which will give us the shortest lever arm or the least amount of pull against the lower abdominal musculature. So Tony will then raise the ball up and lower it down, keeping the knees fully bent. Once he can accomplish the prescribed number of repetitions with this particular knee position, he will slowly start straightening the knees. For instance, if you tell the athlete or patient to do 12 to 15 reps and they are not able to make it to the 12th repetition without the spine beginning to rise up off of their fingers, that indicates that they need to bend the knees more, which would reduce the load until they find the point at which they can work within the repetition zone. Now, as you see here, Tony is progressively straightening his legs to demonstrate that the overload can be increased by straightening the legs more and more, once again lengthening the lever arm. Once you achieve a straight leg position, you can increase the overload further, of course, by adding a larger medicine ball. Now, if you constantly use this hip flexion, hip extension pattern, it can become boring to the athlete. So what I like to do is integrate hip flexion and hip extension exercises coupled with this, just the bending and lowering of legs can be coupled with leg extensions coming out at an angle like so. So what we do is start high. Now, just like keeping the knees fully bent, the higher you go, the less lever arm you have against your lower abdominals. The lower you go, the tougher the exercise gets. These exercises are performed at slow speeds because they're strengthening exercise. Now, there may be cases where someone that you're working with has a flat low back or may have a disc condition or a previous disc condition, and it's always a good recommendation to support the lumbar spine. One way to do it is to place the hands under the low back. Another method is to fold up a towel. Just take a standard bath towel and fold it up so that it's about the width and thickness of your patient or athlete's hand when compressed. Place it under the spine at the umbilicus level or so it nicely supports the lumbar spine. If there's a tail on the towel, it should always go up. If the tail goes down, it reduces the height of the lumbar support by the thickness of the tail due to the fact that it lifts the ischial tuberosities up. So we always want the tail on the towel going up the spine. This is very, very important for people that have any kind of an existing or recent spinal condition. Now, these exercises can be used in a plyometric format. What we can do is have Tony hang on to my ankles and straighten the legs up. And then what I will do is I will push his legs toward the floor, and he will quickly bring the legs back up. Now, I only allow him to work in the range that he can operate without losing his spinal position. Once again, if the spine rises off the floor or off the ground, then what we are doing at that point is influencing overdevelopment of the hip flexors without proportional development of the postural stabilizing lower abdominal muscles. Now, once again, the progression here is to push harder and faster or to put a bigger ball between his feet. Now, an effective plyometric exercise, which can be used for divers, gymnasts, anybody that needs quickness in the hip flexor musculature, be it sprinters, speed skaters, hockey players, soccer players, etc., is this explosive hip flexion exercise. Once again, your criteria for this exercise is that the back never rises off the ground. By the time an athlete has progressed to this level, to being able to do this exercise, they will have a very good proprioceptive sense of where their spine is at. They will no longer need their hands placed under their spine, and they will be aware when the lower abdominals are being over fatigued and being canceled out by the hip flexors. So at this point, we're going to demonstrate this exercise. We're going to go up and over. We'll do it in slow motion. I will throw his legs down at an oblique angle, and he'll come up to Jackie at an oblique angle. And what you see here that's different than the sagittal plane exercise is that now he has to incorporate some oblique movements into the trunk, which is more challenging. And then, of course, we just speed the exercise up. He explosively flexes the hips as quick as he can. We throw him down quick. He brings them up quick. Quick as you can go. Now you see he's only allowing himself to go as far as he can go without losing the spinal position. If the back arches, then we stop the exercise. That's an indicator of poor form, resulting most likely from fatigue. Great. The prone Superman exercise is an excellent exercise for conditioning the trunk, hip, and leg extensor musculature. This exercise is well described in my scientific back training video series. A progression on the exercise is the use of medicine balls to provide an overload beyond that can be achieved with the person's upper and lower extremities. To use the medicine balls effectively, you can place one in each hand. To isolate the trunk extensors and the glutes, we have the patient or athlete bend the knees, holding the ball between their feet, and then going up into extension and back down. I've found this exercise to be very useful to aid in the restoration of a lumbar curvature for those people that have lost their normal lumbar curvature either from sitting too much or as a result of a posterior disc bulge. Now, the exercise must be done carefully with people that have hyperlordosis. With this exercise, for people that have hyperlordosis, you want to start the exercise by having them activate the abdominal musculature, tucking the tail under, and at this point we want to try to minimize the use of the lumbar extensor musculature and maximize the use of the trapezius musculature and the hip extensor musculature. If they're constantly being pulled into lumbar lordosis, you may need to go through precautionary steps such as stretching the back musculature and going through the evaluative procedures such as Thomas test, etc., as outlined in scientific back training video series. Now, the exercise can be progressed to an explosive exercise for athletes such as wrestlers that must perform in a prone position and have explosive power. As many of you know, the lumbar extensor musculature are predominantly slow twitch. We can improve the speed of contraction of these muscles by using faster exercises such as the prone Superman done explosively as follows. You can see that Jackie takes the ball in her hands and she explosively comes up into extension, which recruits the trunk extensors and the hip extensors very quickly to toss the ball in the air. The exercise is progressed, of course, by adding weight to the ball or getting a heavier ball. If the exercise is done such that she slows down, that's an indication of fatigue or that the ball may be too heavy. The exercise should be done fluidly and quickly. Go ahead. Now, if it looks like the athlete is struggling to get the ball up, then it's a good idea to stop the exercise and follow the guidelines given in the beginning of this video series for designing medicine ball training programs. Let's do a couple slow with poor form. What you will see when the athlete fatigues is that there will be excessive flexion of the elbows and knees as a form of altered recruitment. That would demonstrate poor form. Many exercise programs are deficient in frontal and transverse plane exercises. Most exercise programs are very sagittal plane dominant or front to back dominant, with exercises such as the squat and the lunge and bench press and rowing. All these things are very sagittal plane dominant. Because most injuries happen in the transverse plane and the frontal plane, where most athletes and individuals are weak, we want to begin our frontal plane loading in a relatively safe environment, unlike the back hyperextension bench. Many people begin side flexion exercises on a hyperextension bench at horizontal. Now, your trunk weighs 60% of your body weight. So, for example, a 100-pound individual performing their first side flexion exercise off a back hyperextension bench will be lifting a load of 60 pounds. And this is why many people have injured backs doing these exercises and avoid the exercise. The best place to start with frontal plane loading is on the floor in a controlled environment. I've borrowed this exercise from the book called Somatics by Thomas Hanna, and what I want to do here is show you the exercise and how to modify it using medicine balls as a form of progressive resistance. This exercise would then be progressed up to the 45-degree incline and then the horizontal bench. This exercise is performed by flexing the hips to 90 degrees, the knees at 90 degrees, and to protect yourself from pulling on the head and the neck, we want to cradle the head, keep the head in alignment with the spine. The first part of the exercise is done by internally rotating the femur, raising the foot, and you'll feel activation of the quadratus lumborum, internal oblique, and external oblique. Next, we incorporate side flexion of the trunk in the frontal plane, and then we couple these two motions together. Now, to create a progressive overload, the medicine ball can be placed between the feet, and you can place one behind the head to balance the load. The exercise is then completed in its entirety with side flexion of the trunk and internal rotation of the legs and side flexion of the pelvis. What you're seeing here is he is raising the ball with his feet, which requires a strong contraction from the oblique abdominal and quadratus lumborum musculature. Once he can perform the prescribed reps in the repetition window, you would then progress to a 45-degree angle bench and then to a horizontal bench using progressive overload as described. The kneeling and standing side flexion exercise or side toss is a progression from the Hanna side flexion exercise demonstrated earlier. This is an excellent exercise for creating a frontal plane load. We do the exercise from the knees to eliminate contribution from the ankles and hips when you want to get a specific isolation of the abdominal musculature and all muscles involved in side flexing the trunk. As mentioned in the basic sciences portion of the video, we want to start off the patient with side flexion in the concentric phase only and progress to the concentric eccentric type of loading. Now, to progress to concentric eccentric, I throw the ball back, he catches it in the frontal plane. The higher and the faster I throw the ball, the more work it is for the patient or athlete. Done with a partner, the exercise looks just like this. once again, the exercise is progressed by increasing the speed of movement or the weight of the ball. The standing side flexion exercise integrates the ankles, knees, hips, trunk, and arms, and is a progression, once again, off the kneeling side flexion exercise, and is the furthest progression from the Hannah side flexion exercise. This exercise can be progressed with increasing the speed of movement and the weight of the ball, as discussed earlier. Attempts are made to stay in the frontal plane. In other words, we want to minimize forward bending, backward bending, or rotation, and try to keep the exercise in the frontal plane to condition the muscles that are seldom conditioned with most exercise programs today. And do a few reps facing me so they can get the back view. The twister exercise is an excellent exercise for any athletes, such as soccer players, that need increased lower body agility. The exercise is performed by placing a medicine ball between the legs and twisting the torso left and right against the lower extremities. By dropping down further into the squat position, the lever arm is lengthened, which increases the overload against the abdominal musculature. For increasing the speed of the exercise, the athlete does it from a vertical stance, at which time he can go quicker and more explosively.